This video is for any physical therapy student or current physical therapist that is considering doing an orthopedic residency. Hello, my name is Jacob Travis. Everyone calls me JT. I just completed my orthopedic residency at Johns Hopkins Hospital in December of 2021. So I'm just going to be talking about why I chose to do the residency and what my experience was through the entire 12 months, the good and the bad. So I went straight out of PT school right into the residency. I graduated from Emory University in Atlanta in 2020, and a couple months later I was at Hopkins. So for me, I knew what I wanted to do by my third year of physical therapy school. I knew I wanted to do orthopedics and sports. And I wanted to be a specialist. I was very ambitious. I wanted to learn as much as I could. And I felt like the residency was the fastest route to getting to where I wanted to be. Now, you don't have to do a residency to, become a better physical therapist, but it's specifically designed for the therapist. It's not, there is that business aspect of it, but much more of the thought process behind a residency is less about, learning the billing and, filling up a schedule and marketing or whatever. It's about becoming a better physical therapist. That's it. So that's what really drew me to the residency. But I think the first question you have to ask yourself is, are you 100% sure that you want to specialize in this particular field? Because, there are 9 different specialties that you can choose to specialize in. Mine is orthopedics. So I knew I was 100% sure that, this is where I want my career to go. But it's just an honest question that you got to be very real with yourself about is, do you want to dedicate at least this very early part of your career to this one field? And you also get to look at, the benefits of doing the residency, which are usually a lot of them will have teaching opportunities. So that's something that I was interested in. I got to teach at George Washington University in Washington, D.C. That was a huge draw. I was interested in taking the OCS exam, becoming a board certified orthopedic specialist at a young age. That was very attractive to me. And then it was really, like I kind of talked about at the beginning, the individualized mentorship is unmatched, in my opinion, in any other physical therapy clinic. It's just like that's what it's made for, So that was, at the end of the day, that was the main thing that brought me to the residency. So you just have to ask yourself what you want out of your early career or wherever you are in your physical therapy journey. Is just being honest with yourself with what you want. So getting into the big pros of doing a residency, I got to start out with what I've been harping on so much already, which is that individualized mentorship. Just like how we preach how important it is for us as therapists to individualize our treatment to each patient, I think mentorship for a physical therapist needs that individual touch, because every young physical therapist, I think not even young physical therapists, I think every physical therapist needs a certain type of mentor. They learn different ways. They have different pitfalls. They have different strengths. And the mentor's job in a residency is to kind of learn about you as a student of physical therapy and tailor the mentorship hours to what you need. I don't know another avenue of getting that level of mentorship. And that's really what defines or really what is the hallmark of that accelerated growth that you get from the residency. That's kind of one of their phrases that they like is, it's a 12-month residency, but at the end, it's kind of equivalent of being a therapist for like 3 years. It's just because of that's how long, that's how accelerated your growth is as a physical therapist. The second one is manual therapy skills. This one is, I guess, more specific to the orthopedics and sports therapists. There are definitely other manual therapy techniques in the other residencies, but I think it's a little heightened for orthopedics and sports just because of the breadth of skills that we need to understand and master. Specifically at Hopkins, we had about a list of over 100, maybe 150 different manual therapy skills that we had to get checked off throughout our time at the residency. And not only, can we do it, can we do the skill, but do we have the clinical reasoning as to why? Can we progress it? Can we regress it? How do we know if the patient is, having a good response to it? Answering all those questions about each one of those skills. It sounds like a tall task, and it is. But we had a full year of being able to do it, so it didn't end up being a huge deal. But that level of mentorship, that level of practice is what you're signing up for with the residency. But while it's a lot of work, you're going to learn so much, and you're going to come out of that residency extremely confident as a manual therapist. And that's a big thing in our field right now too, is the importance of putting your hands on a patient and being confident with that. So yeah, that was a huge thing I took away from the experience. Another big benefit of doing a residency is just how well they prepare you to take that board exam at the end of the residency to become a specialist in your particular field. For me, again, it was orthopedics, so I took the OCS exam. That exam is it sucks. I'm just gonna be honest. I'm not gonna sugarcoat it. But doing the residency, everything is. They have this in mind, like, all right, at the end of this kid's going to have to take this really, really hard exam. What do we need to do during the residency to make sure that he has all the tools necessary to, pass this exam? So, we had quizzes, we had, journal articles that we had to read. We gave presentations. Our mentors would, grill us on certain patients. They'd ask us, some pretty specific questions. And it sucks, like, during, as it's happening. But, you look back on it, like after I've taken the exam and I've gone through all the residency, I remember what all we learned. Everything kind of lined up. It made sense, like why they were doing this, why they asked these questions. And that, again, like that's just something that I can't speak to every physical therapy clinic, but I'd say it's extremely rare to get that level of preparation for this exam. So if you're interested in taking a certification exam, a residency there's not a better way, I think, of preparing for the exam. And the last pro I will mention is something that I don't think is talked about enough in our field, but that's just the networking and relationships that I now have with some of the best physical therapists, I think, in the nation. They were tough on me during the residency, but that's just because they cared. They wanted me to become the therapist that I wanted to become. They wanted to do, like, they signed up to be a residency mentor. Like that's, there's a reason that they're there. They weren't forced to do it. So they want you to ask questions. They want to see you grow. And now, I have several mentors, that I don't work with anymore, but I'm bonded to them, for my entire career. Like I'm going to have these people as mentors to go to. And then you never know in the future, what that network could blossom into, in terms of job opportunities or research partnerships, things like that. Like that's not talked about enough, I think, in our field, just the camaraderie and the networking between different physical therapists across the country. That was a really cool part of the residency that I'm really grateful for. While there are some obvious benefits to doing a residency, there definitely will be some drawbacks that you do have to consider as you're deciding if this is the route you want to take. The first one being, at least for me, increased work with reduced pay. So it might be different for different programs, but the majority of residency programs, they will give you a reduced salary just because, you're not in clinic as much. You're not doing profitable work sometimes, like doing, extra study hours or doing, teaching at a university, things like that. Like it's not generating revenue for that clinic. So obviously they're not going to pay you for it. That's just something you're going to have to do research on, like, cause each program is different, like, the tuition or, the pay, whatever, like how many hours you're working. So just something you have to look at. But it is something that, is definitely a turn off for many people for doing the residency. And I'll say, and number two for me, at least, again, this is more maybe my stuff, but like that work-life balance was pretty tough to figure out at first. Maybe that's because I I was a new grad, like I was right out of school going into the residency. Maybe it was just getting into that, but I felt with the residency, because we had those extra quizzes, extra, modules that we had to go to, journal articles or things that we had to do presentations on, and we just had so much going on alongside the actual, clinic work that as physical therapists and that those mentorship hours. So even though we were technically only working 8 hours a day, I'd be waking up early to study, or I'd be staying up late to do, paperwork or do a presentation or prepare for class. Like, it's a lot of work. And so, trying to find that balance between work and having a social life, it was tough for me to figure out. But I got into it, as the months went on. I talked to some mentors about it, my struggles with it, and they were super supportive of me kind of taking a break and going out more. And we had vacation days, so like I got to get out a little bit and explore. So it's just, that's more of a personal kind of journey that you're going to have to go through. But just know that in the residency, there's definitely some increased work that might make that balance a little tougher to figure out. And the last con I will mention is that sometimes I felt like I wasn't an independent physical therapist yet. Like, I still felt like I was in PT school sometimes, just because we had those, the quizzes, and, we had practical exams where, they would grade us on, how we were treating a patient, and like homework and all this stuff. Like, I don't know, like after graduating PT school, like I was so excited to like just be out on my own and like kind of prove myself as a therapist. And maybe I needed that kind of that humility check. Like, hey, you're still, there's still a lot to learn. You still need to be kind of a student of the game. And I think that's an important part of, an entire physical therapist career, is being a lifelong learner. And I like that aspect of it. However, it's tricky to kind of walk the line between still being in PT school and being an independent practitioner. So, sometimes I felt like that, but you could see that as a pro or a con. I kind of saw it as something that, I wish could be changed, but, that's just is my experience. I'm just talking from the heart. So after hearing everything I've had to say, I'm sure you might have a few questions. Feel free to, reach out. I'm more than happy to answer any questions. That's the reason that I wanted to, put this video out there, is because I didn't have anything like this to go off of when I was deciding if I wanted to do a residency. So I just thought I'd put out some ideas for you to think about and give you at least one resource to reach out to if you're seriously considering this. But my last thing that I'll leave you with is that it is totally an individual decision. Like, just because it was the right route for me might not mean it's the right route for you. But definitely, my biggest piece of advice is just do your research on the programs, know what you're getting yourself into with the curriculum and the salary, and does it work out for your life, and everything that goes along with this decision. Like, take your time, don't rush into this. But at the end of the day, for me, I would do it. I can't imagine starting my career out any other way than doing the residency. So for me, I'm really grateful that I did it. I'd love to talk with you more about it if you'd like me to. But yeah, just do your research, and I wish you the best with whatever decision you make. All right. Cheers.